Perfect. All right. And that's kind of what I want this one to do. I'm going to do a series of these. And this first one's going to be kind of just like an introduction. And everyone's heard leaky gut, but kind of want to do like a deep dive into leaky gut. Like, what is actually happening? What does it mean? Those kinds of things, like the basics, like what is leaky gut? How does it happen? Those kinds of things. And then we can do, and then in subsequent lessons, I want to do like how leaky gut can affect your health and contribute to certain actual medical conditions like leaky gut and depression, things like that. So we're going to kind of start broad today with like leaky gut 101 and then kind of dive deeper as we go. And I have this cool picture. You can see that, right, Sue?
Yes, I can.
That's really cool. I love this picture. It's a really cool picture that kind of like summarizes a lot of what we're going to talk about today. So I'm just going to leave that up there kind of as I'm just kind of verbally going over some notes and things that I put together. So let's kind of start at the beginning, right? So when the digestive tract, it really all starts with inflammation, right? So when the digestive tract becomes inflamed, and what you're looking at here on the screen is like a close-up of like the lining of the gut, right? So we have the bloodstream, and then we have these little cells that line the gut that reach out into the lumen of the intestine, which would be up top, like kind of where it says leaky gut, healthy gut. That would be like where the food is passing through, and then the cells that line the gut, and then the bloodstream. So the cells are like the barrier, which you can see over there, intestinal mucosal cells on the left. So you can see the junctions, those three little lines where, and there's an arrow there pointing to tight junction. They get compromised. They become broken down. They get widened, if you will. They become permeable, or they become so permeable obviously means more things can pass through them. And things like large undigested food compounds, toxins, bacteria, those can get in when they're not supposed to, right, down to circulation. That's where we develop, AKA leaky gut. So these large compounds, these undigested proteins, things like that, they get absorbed and they get into the bloodstream, and they cause these exaggerated immune responses, right? So now your immune system, which you can see these immune cells, these yellow guys in the bloodstream, have to react to these things. Kind of kicks off this vicious cycle of inflammation and then more loss of permeability, or more loss of this barrier function. So it kind of spirals out of control. So the intestinal tract becomes inflamed through things like diet, lifestyle, medications, infections, right? Which promotes further intestinal inflammation, and this kind of self-perpetuates, right? So it's not uncommon for, patients with any kind of chronic health issue to suffer from, ongoing leaky gut for years, a lifetime sometimes, right? So, and to top it all off, forget about things just passing through to get in to cause problems in the body, right, in the immune system. Now, the cells that line the gut, right, are also responsible for digesting food and releasing enzymes and absorbing nutrients, right? So now they're going to have problems doing that also because they're being damaged. So you can have problems with like vitamin deficiencies, malnutrition, food sensitivities, yeast overgrowth, all that kind of stuff, right? So this becomes, like I said, this kind of vicious cycle, which is why we use such aggressive dietary and nutritional strategies, like everyone here is quite familiar with AIP protocols and supplementation and things like that. So that's kind of the basics as far as like how you develop this and how it happens. That's why I love this picture. Now, let's talk about, okay, this is how you get it. What does it look like in real life? Like someone walks in my office, or how you feel, or friends or family members, however, what's the clinical presentation? Like, how does this show up in a person? Okay. And again, a lot of you guys know this stuff. Multiple food sensitivities, systemic stuff, right? We're talking about, you guys have all been through this before. We talk about systemic pain, inflammation, chronic bloating, any kind of, digestive complaints, right? Obviously, the most common symptoms are digestive in nature: bloating, gas, bowel movement issues, food sensitivities, things like that. What most people don't think of, but again, you guys know better, is that they may not, a lot of people with this, and again, I'm just used to it because I see it walk in my office all day, every day for a long time, is their primary complaint is not intestinal in nature. So we see a lot of inflammatory conditions like chronic joint pain, skin stuff, especially like psoriasis, eczema, muscle aches and pains, things like that. And which is a big one too, are neurological complaints, depression, brain fog, fatigue, headaches, right? All that kind of stuff. Everyone, and again, that's kind of the big problem with medicine, right? Like mainstream medicine. It's like, oh, if you don't have celiac disease, you can't have a problem with gluten, right? Which is bunk. If you don't have, you can't have leaky gut if you don't have digestive complaints. It's just not true. And again, in subsequent videos, we're going to dive deep into a lot of that stuff. But it's just not true. It's equivocally, not unequivocally, equivocally, I'm not sure which one it is, but it's just not true. The research, the literature doesn't show that. It shows that leaky gut can contribute to all of these things, right? Through this chronic inflammatory and mechanism, as well as the immune dysfunction that it can cause. Okay. So what is it? What are some of the signs and symptoms of it? The last thing I want to kind of touch on today is, okay, how do you get it? What causes it, right? What are the mechanisms? Okay, and there's a bunch of different categories of mechanisms, let's say, that can cause this, okay? And some of them are going to sound familiar to pretty much everybody, right? And if you think about most of us, right, at least until you got here, and this was me until I obviously made these changes in myself, but just think about most of America, right? Think of your friends and your family and people you know who who aren't weird like you. And I had to talk with someone in the group today. It was like, just be weird. Being weird is good. Like if you're the oddball at the picnic and everyone else is eating that junk, then you're better off. You're way better off. So what are some of the mechanisms, right, that cause this? Obviously diet, right? I mean, it's called the standard American or SAD diet for a reason. Alcohol, gluten, right, everywhere, all the grains in general, casein, which is milk proteins, processed foods, excess sugars, fast foods. Pretty much sounds like America, right? That's why we're chronically ill half the time, and we do it to ourselves. Medications, right? And look, medications are necessary sometimes, but chronic use of things like corticosteroids, antibiotics, antacids. I mean, these things are given out like candy, right, by mainstream medicine. Chronic infections, H. pylori, bacterial stuff, anything bacterial, really, overgrowth, like good or bad, yeast overgrowth, right, intestinal viruses, parasites, all these pathogens that we work so hard to take care of. Stress. We live in a chronically stressed out society, which takes things like cortisol through the roof, damages the lining of the gut. Inflammatory cytokines, things that our body releases, catecholamines, things that our body releases in response to stress that can be very inflammatory. Hormones, right? Hypothyroidism, right? So low thyroid hormones, low progesterone, low estradiol, low testosterone. So if these hormones are lower, they can contribute obviously to really out of balance at all, to be honest with you. Again, why we look at this stuff. We have to look at hormones. We got to look at adrenals. We got to take care of infections. Sounds familiar, right? Sounds like the protocol that we use with you guys and continue to use. Neurologic stuff, right? Like strokes and trauma, brain trauma. So a lot of good research out there now showing brain trauma can actually lead to leaky gut. It's crazy, like head injuries. And any kind of metabolic condition, right? So the big fancy term glycosylated end products, that's diabetes, like type 2 diabetes and things like that. Anything that causes intestinal inflammation, really anything, which is pretty much all the above that we described. Autoimmune conditions, super common for the gut lining to get damaged with any type of autoimmune condition. So again, sounds like a lot of people, right? Sounds like America. It's like diet, medications, stress, hormones, metabolic stuff. Excuse me. All the above, So, and I hope it makes a lot of sense as to exactly why. Like, there's always a method to the madness. Like, we don't ask you guys or teach you guys to do things to torture you. It's all based on like, hey, look, these are the things that lead up to cause it. This is the symptoms you get from it. These are the conditions you can develop. A plus B plus C equals D. Okay, in order to unwind this, kind of like I said earlier, we need aggressive lifestyle, dietary, and nutritional strategies to help clean all this stuff up. To clean it, like let's fix the things we can fix. Let's clean up the diet. Let's deal with any infections that might be in there. Let's work on stress and the adrenals. Let's balance the hormones. You know, let's always take the medicate, maybe take less medication, or the ones we don't need. Let's fix this stuff so then we don't need those medications to treat the symptoms that are coming from it. You know, so there you have it. What is leaky gut? You can see it on your screen. What does it look like? Sounds familiar to most of you, I'm sure, and people you know. How do you get it? Right, it's the big ones: diet, medications, infections, stress, hormones, neurological stuff, metabolic stuff. Not like it's a lot of stuff. Hope that makes sense. Any questions, Sue? You're the only one on the hot seat.
Okay, very good. Oh no, I have no questions about that. I get it, but I also understand that if you have too much hormones, like the last doctor that got a hold of me, and I had neurological problems with the high testosterone in my arms. Remember that?
Yep.
Well, it went away. I'm sure my testosterone lowered, and remember you gave me the one thing to take, and believe it or not, I don't have that tingling anymore. I don't have those sensations anymore in my arms. So it's amazing how much hormones can affect things.
And you know, and that's again another thing that drives me nuts just with mainstream medicine is it's just such a fundamental difference in how patients are treated. You know, they run a lab test. You have, you know, like with guys, right? You have low T. We'll just give you T. We'll just give you testosterone.
Yeah.
Yeah,
Yes.
makes it come up on the labs. Good, we're done. You're better. It's like it doesn't work like that. Like our
Yes,
bodies don't work like that.
It's so hard when traveling, because when I'm on the West Coast, I can't fly back to Florida to go to my regular one that keeps me at a constant level, that really watches my blood work and everything. So, I mean, the other person messed me up, and boy, was my regular doctor angry about it. He was very upset because he had me at a dose that worked for him and me, and she got me out of that, you know, and it's amazing how it affected me.
Yep. We're talking about some of the hormone stuff. One of my colleagues who I trained under to learn all this stuff, his name is Dr. Karazian. I think you've heard of him. Some other people in the group have heard of him. And a lot of some of the supplements we use from Apex, like he formulates their supplements from them. He practices out in Southern California, San Diego.
Yeah.
And I've heard him lecture obviously a bunch of times and like I said, study all his materials. And he one time said, he's like, I could make a healthy living, because in Southern California, right? It's like the capital of like looking good and feeling good all the time.
Yes. Yes.
So he said, I could make a very good living, a healthy living, just in practice, just fixing all of the people that these anti-aging clinics down here are messing up.
Yes.
You know,
yes.
like because there's an anti-aging clinic on every block, you know, and they're just jacking people up with hormones and HGH and all this kind of stuff to get them looking younger and feeling younger, and you know, to get 60-year-old dudes that are all buff, which is not possible, you know, and but people will pay handsomely for that a lot of times, you know. And he's like, I can make a very healthy living just fixing the people that they screw up.
Absolutely. Yes. You know? And weirdly enough, it was a woman who did it to me, a woman doctor.
Yeah, sure.
I think she thought the more testosterone she gave me, the better I would feel, which is not true.
It's just, it's how they're trained. It's just, it's medical training in this country. It's like, do this lab, this is low, give it that. Like, it's just how they're trained, like the pharmaceuticals for everything.
I was going to tell you, one of the first things I noticed that I'm starting to go towards leaky gut, and some things have started that process all over again, is me not keeping the metabolism going. And I start gaining weight gradually. Okay. And not changing how I eat or how much I eat. So that's to me, that's a thing like, wow, I need to do it again. It's been 6 months. I need to do the whole regimen.
Yeah. And that's, you know, that's usually that's always my baseline, like my default for anybody is like, hey, look, I'm taking care of the things I need to take care of. Like I'm not on these medications and my stress is good. Right. And, you know, and I tell people, yeah, but it's also at the same time, life is life, and it's like
Yes.
a lot of times it's literally as simple as like just running through another round of the supplements that we use to heal this stuff, just to
Yeah. Well,
just clean it up, like the repair bite,
speaking of another round.
probiotics, that kind of thing.
Yeah, speaking of another round,
Yeah.
remember when you give those three things, get those or three or four things or whatever, but you
Yeah.
didn't have the apex. Remember the first time that you people do the protocol, they have the probiotic in there. And they
Yes.
don't. When you do another second round, or this will be my third now, but when you do it again, there's not that. And I felt like, ooh, I think I could have used that. Now,
Yeah,
why?
I'll usually do that unless someone's taking a probiotic already.
I don't.
Yeah, so if someone's not, then I'll typically recommend doing the Strentia probiotic with the repair bite.
Okay.
Sure.
That's what I'd like you to put into the
Yeah,
next
sure. I'll put it in full script for you.
Okay, perfect,
Yeah, no
perfect.
problem.
And I did want to tell you, both of us lost a parent, last year, I told you,
Yeah.
and stress. By the way,
Yeah.
you are spot on. When I lost my mom, she was my best friend. And it was like, I gained right away within a few weeks, 10 pounds. You know what I mean? From the stress, the cortisol levels that I had from what I had gone through,
Yeah.
So stress.
That's a big one. That's a big one because like we just live in such a stressful society and in a stressful environment, and it really, I mean, stuff like that happens. It's life, right? And
It is. It
but
is.
outside of those big things, like
Yep.
you really, really, really have to try really hard and really safeguard yourself from our world, because it's
Yes.
such a negative Debbie Downer world out there that if you pay
Oh,
attention
and
to
if
it,
you
or if you
watch
watch
the
the
news,
news all the time, like it's gonna do it's
I know.
nothing but garbage.
We can't believe what's happening in the world. And we try to stay positive, and it really is difficult right
It's
now.
huge.
Sure. Yeah. I didn't vote for who's in office. So it's real. And I can't believe what he's done to our country. We are the laughing stock of the world.
It's making sure that you have a kind of a go-to stress coping mechanism too.
Yeah.
Whether that's exercise, or whether that's meditation, or whether that's prayer, or whether that's handstands, I don't care.
I
But
know.
it's having that stress coping mechanism. Like, for example, I mean, you guys know, for my wife and I, it's typically resistance training. Like, we're in the gym lifting weights.
Yes.
And that's very, and that, not that everybody has to do that, but that's for us, like, that's very cathartic for me. Like, I start off my day with a tough workout, and it's the hardest part of my day. The rest of my day is downhill at that point. You know what I mean?
Yeah, right. Right.
And obviously the benefits of exercise, the physiological benefits of stress relief and exercise, are obviously well documented.
Yeah.
But for stress,
I
stress
remember
happens. It's having those coping mechanisms for that daily stuff to keep out garbage.
Yep.
And to deal with the things daily that we need to deal with.
It's true. And you may have already put this out for everybody, and I don't know where the resource is, and you could tell me, but I'm getting ready to do blood work again on the 25th. And I told you, it's very difficult to find an endocrinologist that'll do the complete comprehensive panel. Do you have that anywhere that I could send my doctor? Like, everything in a nutshell, because she tries to pare it down and not put the PTO and not put, the antibodies in there and stuff like that. And I mean, I'll get another, if she's not going to listen to me, she knows I'm going to leave her. I've told her. So is there a list anywhere like I can give her and say, this is everything I want in this test?
I don't have that. I can probably email it to you, like just shoot you a quick email, but
that's fine. Sometimes I just
I really should have that, but
white.
Yeah, I really should have that, like, on a template. I mean, I have it here in my office because I have my script, and I just circle, like, these are ones I do all the time.
You know what you could do? You could just put it on the circle and just put it in the area. Well, there's food, but there's another area, I don't know, announcements or whatever. But I think a lot of people don't know.
Yeah.
Hey, it's not just ABC, it's DEF that needs to be there. So I thought that would be helpful for people that, I mean, I've had her 3 years and she's been good, and all of a sudden she's going downhill. And it's probably because the insurance
is, tell her what to run.
Yeah, gotta tell her.
Yeah.
Anyway, I thought that would be helpful, but I'm gonna go ahead and do the whole process all over again. But if you could put the other
Yeah, so you need to strengthen it. Let me make a note of that.
yeah,
I'll throw that in
that
there.
okay, that would be great. And you're spot on about everything. And we know when it's happening. And you can be very good at regimenting, but there's still stuff hidden in your food.
Yeah. Yeah, it's constant vigilance.
Yep. Thank you so much. You have
All
a
right,
good
you got it. Thanks for joining me. So I'll post this in the group once it's uploaded.
You bet. Not to make you jealous, but it's 63 here.
It's almost 90 here. It's summer.
I know.
Heck, right? It's summer.
It's funny. The name we're in is South Beach, Oregon, but there's nothing South Beach about it. It's cold.
Yeah, my wife was out in visiting a friend in the springtime. They were in Bend. She loved it out there.
Oh yeah, it's chilly out here.
Bend and then Portland, and
Yeah,
she
it's
absolutely loved it. I mean, the Pacific Northwest in general is right up her
oh
alley.
my
She's
God,
very
it's
outdoorsy, and very
beautiful.
health conscious out
It
there.
is Mount Hood, and the snow on it is
Yeah.
just unbelievable in
Crazy,
July.
right?
You
I know,
know.
it's gorgeous.
All right, thank you so much.
You
We'll
got it,
talk
Sue.
again. All
Thanks
right.
for joining me. All right, see ya.
You bet.